Thanks, Sarah. We are very happy to be here to introduce Michelle Bowles, our Prime Federal Liaison, our leader of our federal partners, and she's going to walk us through all of our agency updates. Michelle?
Yes, thank you, Alex, and thank you, Maria. Thank you for your leadership of FDP, first and foremost. We're really excited to have you guys here and joining us today. I hope you guys have enjoyed the morning sessions with our FDP leaders, and I hope that you will certainly enjoy our federal updates. This is really an opportunity for our feds to share with our federal institutions and others, each other, what's changing, what's continuing, what's new. And so having you guys in the know and making sure that you all are able to take in all of the changes that are happening across the federal platform, and to see how some of us are truly operating in a very consistent manner. So with that being said, I'm going to introduce our speakers in order today. I'm going to start off with our very own Dale Bell. Dale is the Deputy Assistant Secretary for Grants. He serves, he's at the Department of Health and Human Services. He's also serves as the Council on Federal Financial Assistance COFA co-chair. And then on top of Dale, or behind Dale, will be Jennifer Riggle. She serves as our Director of the Division of Grants Policy and Planning within the Health Resources and Service Administration, HRSA, which is a operating division under HHS. So I'm going to turn this over to Dale, and we will get our federal update started. Thank you again so much for joining us.
Thanks, Michelle. Hello, everybody. Nice to see you again. I'm here with Jennifer Riggle to talk to you about Simpler NOFOs. I'm going to spend just a few minutes on the HHS approach, and then we're going to move into some more specific information with HRSA. Next slide, please. So next slide, please. So the Office of Grants here at HHS has launched a program called Simpler Grants. And right now it's made up of two components. One is simpler.grants.gov. And I recommend you go to that site. It's a total transformation of grants.gov to be more accessible and modernized. And the second part is Simpler NOFOs. And that's what we're going to be talking about today. Next slide, please. So Simpler NOFOs. What we're trying to do is lower barriers to applying. We're trying to reduce burden, and we're trying to just be better partners with our communities. And how do we do this? The Simply NOFO program within HHS is focused really on three things. One, looking at the language to make sure that we're making it as clear as possible. Two, looking at the format and design to making the interaction with the applicant community easier. And three, looking at NOFO content. What has to be in the document? What does not have to be in the document? Next slide, please. So our approach has been one of learn, scale, and then rinse, rather, and repeat. The first thing we did was spend a lot of time with research specifically around customer service, understanding what the challenges were to interacting with our communities using the NOFO. So research. The next piece we did was prototype. What is it that we think are ways in which we could dramatically improve the way we communicate through the NOFO process? The third one was pilot, which is test some of our hypotheses and look for scaling opportunities. And then the fourth is scaling. So we are wrapping up the pilot program and we're beginning the scaling program. And next slide, please. What we found during the pilot is that there was substantial opportunity for improvement in the development and the publishing of NOFOs. And you're going to get these slides, so I'm not going to repeat any of this data, but I do want to point out that what we saw, and we're still getting results in from the pilot, is a marked reduction in application time for those who are least exposed to the federal audience. So we're leaning into that. The other types of information we're hearing is that these applications are much easier for grants managers to review. And we've also heard from other communities about how this is moving us in the right direction. I do want to just shout out HRSA for being such a wonderful partner with us, both during the pilot and during the scaling, because now what we're doing is moving into an area where each of our operating divisions are rolling out their version of simpler NOFOs across the full portfolio. So we've got 80, 85 under our belts right now. We're now moving into a phased area where we're going to be doing about 250. So thank you for this opportunity. I'm going to turn it over to Jennifer, who's got some more specific information to share with you all.
Thank you, Dale, and thank you for your leadership on this effort. Next slide. In preparing for my presentation today, I decided to go back and review the purpose statement of the Federal Administration Partnership. I noticed it includes streamlining the administration of federally sponsored research, and you have a goal for researchers to spend more time doing research and less on administrative work. So HRSA agrees, and that's why for the better part of these 2 years, we've been actively engaged with HHS towards this same goal. In preparing for my presentation, I also looked at your 2018 Faculty Workforce Development Report, and I found it spoke to the same concerns, and I'm happy to hear you're updating it. We found the same with the survey of our recipients. So let me tell you more about what we're doing. As Dale mentioned, we've been working with HHS in 2024. We had 8 pilots. The simpler NOFO pilot showed incredible promises for improvement early on. So I'll talk just about a few metrics we had that are HRSA specific, so slightly different than Dale's information. The NOFOs decreased word count and reading time by up to 44.5%. And we reduced the reading level by 3.5 grade levels. And for those reasons and the positive feedback we're getting, we are full tilt scaling up right now. In FY25, we're back on track to have 62% of our NOFOs, which is 56 of 89, to be simpler NOFOs. And we anticipate full adoption by FY26. So the next time you apply, you're likely to find HRSA NOFOs look better. They navigate better, they're shorter, less burdensome to read, and hopefully we'll find it gives you a better overall customer experience. So I'd like to highlight 3 features. We've redesigned our NOFOs to communicate in a visually appealing way. We're writing NOFOs using plain language principles and organizing information logically. And all of this reduces your reading time and improves your reading ease without compromising content. We're streamlining NOFOs to focus on necessary information. We want to tell you what you need to know, the purpose of the grant, what you can or can't do, whether you're eligible, what you need to tell us in your application, how you'll apply or how your application will be scored, and what will be required of you if you're successful, like reporting requirements. So let's take a look at the NOFO. Next slide. So it looks good, right? On the left side, we have our old NOFO cover page, mainly black and white, a bit of red text in there, but kind of boring. Compared with the cover page on the right, a recently posted NOFO that was developed with a new NOFO prototype, and it looks good. But visual elements in a document do a lot more for you than just make them look pretty. They provide the visual cues and critical information. They deliver high volume of information at a glance by smartly using space and color shapes, among other features. Next slide. So we write like we speak now. We speak directly to the applicants. We use easy to understand terms. We avoid jargon and acronyms. We're writing in shorter sentences and shorter paragraphs. We have vertical bulleted lists. We use white space smart. In some areas, we reduce text for graphics. And of course, they're 508 compliant. Another important change is that information is now logically organized by aligning sections more closely to the application process. On the left, you see the old NOFO table of contents, and compare that with the new NOFO content page on the right. Information is presented in a logical series of action steps. Step 1, review the opportunity. You'll find basic information to determine if you're interested in applying or not. Funding details, key dates, eligibility, and the purpose of the grant. And step 2, get ready to apply. It points you to sam.gov, grants.gov, requirements, and includes technical assistance information. Step 3, write your application. It covers everything you need to know to submit a complete application. Specifically, this is your project narrative, budget, attachments, and required forms. Step 4, learn about review and award. We let you know how we let you know how your application will be reviewed and scored by Merit Review Committee and other selected factors. Step 5, submit your application. That goes on with other important detail in step 6, which is learn what happens after your award, like post-award requirements, reporting, contact information, support details. That's 6 steps. Next slide. We've improved navigation cover to cover. We've added breadcrumbs at the top of the screen, or at the top of the documents for step 1 through 6. You can see that where you're located in every page. This makes it easy for you to jump between any steps, forward or back. It marks where you are in the document. In this example, you can see the reader is in step 1. It's colored red and the others are black. We use call out boxes to draw attention to specific information. We use headers and lead-in sentences for readers to easily identify topics and content transitions. So let me give you an example of how we're conveying high volume information that is easy to find. Look at the basic information page on the right. It has smart use of white space, color, and box text to help you find key information, to help it pop. It conveys need to know details on one page, what the NOFO and the old NOFO took 3 pages to convey this information. Next slide. HRSA uses an R&R application guide. It's our companion document to each NOFO. NOFO links to this document about 12 to 15 times in each application. Consequently, we've made changes to the application guide. They were rewritten to use plain language principles. It's reorganized to match the flow of the NOFO. It uses vocabulary of the NOFO. Additionally, it will soon be available in HTML format on our website for super easy use. Next slide. So I started this presentation quoting OMB's uniform guidance. I'm going to end it in the same way. We're focusing on communicating these requirements to the public in an accessible and comprehensive manner. We think you'll find simpler NOFOs are simply better. You can find HRSA on many social media platforms here on this slide. We encourage you to follow along and share the content on Twitter, Facebook, LinkedIn, and Instagram, and stay up to date on the latest HRSA news. Thank you.
Thank you, Jennifer, and thank you, Dale. We're going to take questions from HRSA and Dale now. And just wanted to alert you that all other questions for the agency updates will be held until the end of the full federal update. So questions for Jennifer and Dale regarding this simpler NOFO.
We have 2 questions in the chat already.
So we can read, would you like us to read them aloud? The first is there any way that the HRSA GEMS organization annual review email could include the name of the person who is seeking the annual reauthorization from the AOR?
We can work with you on that. Send me an email. We can talk about it. It's JRIGGLE@HRSA.gov.
Okay, and then just a kudos that the updated NOFO for HRSA has come a really long way. Great job. Does look great. I agree. So there's a question regarding simpler NOFO and simpler grants. Are they the same?
So Simpler Grants is the name of the initiative within the Office of Grants at HHS. Simpler NOFO is a subset of that. The other part of the Simpler Grants initiative is the simpler.grants.gov program, which is a modernization of grants.gov. They're both grounded in user-centric interaction and research and design, and they've got a nice connection because you go from the mechanism by which we share NOFOs to the world, and we deal with how that information within each NOFO is presented. So they're sister programs under this heading of simpler NOFOs at HHS. Thank you.
Great. There's another question asking where would the review criteria be located in the new document?
was step 5. It was on the slide of the steps. But if you take back a look back at the next one, there you go. Nope. Step 4. You'll see it all there.
Great. Another saying the NOFOs look great. My question is, when can we expect to hear how HHS is going to integrate or change the PMS to include the new edition of the uniform guidance?
Yeah, that's an unrelated question, but I imagine this was going to come up.
Yeah.
We're working feverishly on publishing our IFR, which should be out fairly soon, and I really don't have any more information that I'm allowed to share with you at this point. Thank you.
Thank you. There's a question, will all HHS agencies adopt a similar NOFO? What is the timeline for NIH to do so? Well, I guess this isn't an NIH question, but what about the HHS agencies and what do you know?
Yeah, so yeah, I'm happy to share. So this is a phased approach, and each operating division has unique opportunities and challenges with their communities. So the idea is not to have the same template that everybody uses, but to have all the same design principles incorporated into that work. So HRSA is part of our first push, and we will be learning from this phasing. How do we work with the operating divisions to continue this great work? NIH will be part of a later phase. They've already begun some work with us in terms of language on certain programs. So it will not be this year. I can tell you that, but it is going to be in subsequent efforts as we complete the full phasing. Thank you.
And is this, you might have mentioned this, but there's a question whether simplergrants.gov, whether it will be used by all federal grant making agencies, or is this an HHS initiative?
All federal grant making agencies.
Great.
Yeah,
Okay.
so the site is simpler.grants.gov.
Right.
Full rundown about the modernization. It's going to be great. There's a lot of interaction. I really encourage you all to check out the site. You'll be asked to weigh in. The folks that like to do open source work, they're going to have opportunities there. It will be an interactive, dynamic development.
Great. So I don't know this acronym, maybe you do. It says, are there plans to replace or update EHB as part of the Simpler Grants Initiative?
That's
EHB.
yes, that's our system we use.
Oh, okay.
The electronic handbooks, and they're not linked to this initiative right now.
Okay.
They're not the same initiative, although we are in close conversation on a number of different fronts with HRSA as part of a overall standardization within HHS.
Okay. Do we have time for one more?
If
Michelle?
it's one of those that says what a great job HRSA is doing, yes, we
Well,
do.
of course. How does simplergrants.gov compare to research.gov? I guess in functionality perhaps, or the system behind it, the
Well,
infrastructure?
they're different programs. Grants.gov is the location where everyone can go to find and apply across federal government. Research.gov is a NSF specific system. So they're complementary in the sense that they're connected, but they're not the same activity. One is wide, one is NSF specific.
Great. And I think that's it. Thank you.
Perfect.
Thank you for coming.
Thank
This
you.
is wonderful.
Thank you.
Thank you.
Okay, so up next we have Jean Feldman, who's the head of policy division of the institution and award support at NSF. Jean?
Thank you, Michelle. And it's great to virtually see everyone here at our FTP meeting. I know this is one of the most popular sessions. So let me kick it off with what's going on at the National Science Foundation. So next slide, please. So I've already introduced myself, and thank you very much for doing that, Michelle. Next slide, please. So what am I going to focus on today? And great minds think alike, because there is some of what we're going to cover that was nicely covered by our colleagues at HHS. But we're going to start with NSF's implementation of 2CFR, talk about what that looks like. And we have already effectively put everything out on our website. So I'm going to walk you through all of that. we too are working on simplification of our funding opportunities at NSF. You're just going to see a nice difference in approach. Agencies are all looking for the same thing, simplify those NOFAs, making it easier to apply, particularly making it easier for underserved, under-resourced, underrepresented institutions. So I'm going to talk about that for a bit, and then just finally end with our 2025 PAP guide revision. Yes, it's that time again. I know the last one, 24-1, went into effect on May 2024. However, we're already working on the 25 version. And then finally ending with outreach opportunities. We won't be doing, as has already been mentioned by Michelle, the questions after this. We're going to do all the rest of the agency questions at the end. Next slide, please. So let's go into our implementation of the revised 2 CFR. So of course, by way of memorandum in April, OMB directed agencies to implement the revisions to 2 CFR for awards made on or after October 1st, 2024. So how does NSF implement 2 CFR 200? Well, we implement 2 CFR 200 a bit different from other agencies. And that's really particularly important in the context of our understanding of how we implement 2 CFR. So we do it in two different ways. One is through our NSF Proposal and Award Policies and Procedures Guide, and via our award terms and conditions. We are the only agency that has been given approval by OMB to implement via policy rather than regulation. We think that kind of plain language approach is beneficial to our community, but I'm going to walk you through what the implications are to that as part of this overall revision of 2 CFR 200. So NSF has revised our grant general conditions for awards made on or after October 1st. I'm going to explain in the next slides what that actually is going to mean to all of you. The research terms and conditions that all of you in the research community, IHEs and research nonprofits have used now for many, many years will no longer be referenced in awards made on or after October 1st, 2024. We're going to keep that RTC page out there. It will have a banner at the top saying it's been archived, but we want to keep it out there because obviously there will be a lot of prior awards that were made that will be subject to the RTCs. So we want to keep that information available. So very quickly on this change in concept, the reason we did it this way is that when something is issued in April, has to be in effect by October 1st, in awards on October 1st. That really is not a lot of time, particularly when you're talking summer, particularly when you're talking an interagency type activity. So the RTCs, that doesn't mean that the RTCs are gone forever, but there just really was not sufficient time for us to effectively, and NSF has been the steward for many years, for us to do this in a way that best reflects not only what we need from these terms and conditions, but most importantly, the university, our whole recipient community's understanding. So next slide, please. So how will all of this roll out? Well, when we revise our terms and conditions, whenever there is a new 2 CFR, whenever there's a new PAP guide, really whenever there's annually a need to change these, we walk through a series of award terms and conditions. Our grant general conditions, typically up to now, have applied to for-profit organizations, state and local organizations, and tribal governments. Our cooperative agreement, financial and administrative terms and conditions are for recipients of all cooperative agreements. The RTCs never did apply to our cooperative agreements. We also have what we call MODs and SUPs for our multi-user research facility projects and FFRDCs, as well as for our mid-scale research infrastructure projects. We also have special award terms and conditions for our conference and travel grants. All of those have been updated for 2 CFR and are out there and are available now. We have 3 additional bullets at the bottom, our SBIR and STTR, our international research terms and conditions, and the special terms and conditions for conference or travel that relate to international organizations. Those last 3 in gray are being worked on as we speak. SBIR should be posted very, very shortly, but the bottom line is those are all out there. And now we're going to talk about actually what that means in terms of GC1 for all of you. So next slide, please. So in terms of our overall implementation process, because we do not have the RTCs, unless otherwise specified, the grant general conditions will apply to all recipients of NSF grant awards, including IHEs, nonprofits, for-profits other than SBIR and STTR, state and local governments, and tribal nations. And in the case of any inconsistency between the coverage contained in our PAP guide and 2 CFR, the coverage specified in 2 CFR applies. And I'm going to talk about that a bit more. Next slide, please. So we want to make sure everyone is fully understanding NSF's changes in terms of how we're implementing 2 CFR. So at this point on every program page now, we let you know that NSF financial assistance awards that are made on or after October 1st will be subject to the applicable set of award conditions dated October 1st and available on the NSF website. We're making it very clear that this is consistent with the revised guidance that was specified in the OMB memo that was issued in or posted in the Federal Register on April 22nd, 2024. We also, as I mentioned in the beginning, implement 2 CFR in 2 ways: award terms and conditions in the PAP guide. But you all understand we just put out a PAP guide and it went into effect on May 20. Now, many people were like, well, just go ahead and make the updates to it to 2 CFR. That is impossible for us to do that right now because of how we implement the PAP guide. The PAP guide is about a year process in the making. We go through an exhaustive set of, in fact, I'm going to talk about that at the end, what we're doing to implement the new PAP guide. But the bottom line is, between giving 60 days public comment, having to resolve comments, giving you 90 days advance notice, it's not possible for us to meet that October 1st, 2024 deadline for the PAP guide. We're able to do it for the award terms and conditions and worked really hard to do that. But the bottom line is, no, we could not do that with the PAP guide. Well, how are we going to reconcile that? So we will now, the beginning of October, there will be a header in every chapter of the PAP guide at NSF 24.1 that states that any inconsistency between the coverage contained in the PAP guide and 2 CFR, the coverage specified in 2 CFR applies. That's how we're going to handle this interim period until we get the 2025 PAP guide out there and implemented. Next slide, please. So we also spent, because we know that the GC1 is you haven't seen these for a while when you're in the NIHE or nonprofit. So we spent a lot of time and effort going through this document and doing a summary of changes to the terms and conditions that's very detailed so that you all are able to fully understand what we've done in these terms and conditions. Next slide, please. We also took the best parts of the research terms and conditions, and we they all actually already were built into GC1. But what we've done is taken the national policy requirements that many of you are absolutely familiar with because of the RTCs, and we've morphed it into an NSF-only document. And so it will have all the same vital information that was contained on the research terms and conditions version, but it's been updated. Many thanks to my colleagues Will Grant and Eric Mulch in our Office of the General Counsel that went through and made all the necessary updates to this document. We also know how important the prior approval matrix is to all of you. And so we have updated this document as well. It's incorporated by reference, as are the national policy requirements. And they have been updated to have what the prior approval is, what the 2 CFR 200 reference is, if there is any applicable PAP guide reference. We've included it on this document, as well as if the prior approval requirement is required or waived. And many thanks to my colleagues in the policy office, Beth Strauser and Samantha Hunter, who spent a lot of time getting this document updated. Next slide, please. So now I'm going to briefly go what we are doing at NSF in the way of simplification of our funding opportunities. And obviously, this is a mandate for all agencies. There was guidance published in M2411. They had been working on that earlier than that as our HHS colleagues already described. And we are asked to make our NOFOs now as clear and concise as possible, to limit their length, to limit the complexity and increase accessibility. And also, as part of 2 CFR 200, Appendix 1 updated what is the required funding opportunity template. So what's NSF going to do to kind of take the approach HHS did, but do it in a more NSF-centric way? Well, first of all, we are going to have listening sessions, as I discussed at our session last time, with the Federal Demonstration Partnership. We're spending a lot of time on planning this out. We've already had one session with the FDP leadership. What we're going to be doing is having separate sessions coming up in the future, one for faculty and one for research administrators. They will be 90 minutes in length, but they will be separate. We are working really hard internally at NSF to talk to our evaluation folks to make sure we're asking the right kinds of questions to solicit really valuable feedback from all of you on NSF's existing NOFOs and how we might go about improving that. Next slide, please. So we've convened 2 foundation-wide working groups to consider the most impactful changes to achieve the results. We have a working group, policy office chairs both of these. One is considering the streamlining of the solicitation, and yes, number 2 is considering the content of an NSF proposal. That's not just saying just in time. We are taking a very pie in the sky. What do we absolutely need in a full proposal? What can we do just in time? And what can we do to eliminate sections that are no longer necessary? So this is a very, very broad perspective look, not just for the NOFO, but also for the contents of an NSF proposal as well. So what are we doing to simplify our program solicitations? Well, obviously, we've taken a look at the revised 2 CFR template. We're removing things that are redundant. We're spending a lot of time removing or reducing the length of standard boilerplate length. Many of you who know our funding opportunities know that we spend a lot of time repeating text in the PAP guide. We're going to be taking a look at that and eliminating and using references as well. Doing a lot about plain language that HHS talked about. and using word count or restrictions where appropriate. And also spending time giving better guidance to NSF staff about how they prepare sections like the program description section of solicitations. But we are particularly very interested when we have these sessions, having you have a very frank discussion with us over the kinds of things that we can do from an NSF perspective to improve our NOFOs and the content of an NSF proposal. Next slide, please. So linked to all this, as I mentioned in the first part of this, we obviously have a PAP guide that will have to be revised for 2 CFR 200. Well, we're never boring at NSF, so I can tell you the content of the 2025 draft is currently being finalized. It goes well beyond 2 CFR 200. There is a lot of, still there is more chips in science. There are many areas that we are looking to also implement, a lot of public access. There's just a lot of information, new information that you're going to see in that document. Our next step, once we finalize the content, is to clear it through our NSF senior leadership. We have to do that before we can even post it on our website. We're going to continue to provide you with that 60-day public comment period. You will note that there is a change in timing here. A lot of it has to do with those things in research security. Yes, that's the foreign influence section is this afternoon, and that's going to have an impact on the timing as well. So our anticipated effective date is early October 2025. Next slide, please. These are our outreach opportunities. One, I can tell you we just had almost 3,500 of our nearest and dearest friends showed up for for our terms and conditions section. But we also have a fall virtual grants conference in December, the 9th through the 12th. And that will be, again, virtual only. There will not be a hybrid one for that. So we put this in front of you, lots of information. And then the final slide is just, next slide is just linked to important policy documents. So with that, I turn it back over to you. Next slide so you can, there you go. Let me turn it back over to Michelle for the next session. Thank you.
Jean, thank you so much as always. Very informative. Thank you so much for the details, and we truly appreciate that. We are going to skip to DHS at this time for Michael Pellegrino. He's the director of the Division of Grant Systems. The director of the Financial Assistance Policy and Oversight, and he is at the Department of Homeland Security. And we are very excited to have Mike. Mike, if you want to go ahead and turn your camera on and get ready to give us your update, we would appreciate it. Thank you.
Good afternoon, everyone. Michael Pellegrino, DHS. DHS, my office is called Financial Assistance Policy and Oversight. We are one of 12 OCFO divisions within the OCFO. We're responsible for issuing policy for all financial assistance awards across DHS. And then we have a number of internal control activities to ensure those policies are compliant. So continuing with the theme of NOFO simplification, I'm just going to talk about what we're doing internally at DHS. Starting off, though, first also as part of N2411 and the subsequent control alert, we're trying to move from one AL to one sub-program. At DHS today, we have 65 programs, and 15 of those programs have 38 sub-programs. So as part of this annual update that's due by November 15th, we are going to one AL to one program, with the exception of one program. We are waiting. We've had discussions with them on their compelling reason as to why not to move to one. So that is it. But basically what we're going to go is we're going to land on roughly 80, possibly 82 programs. So that's where we're going. Okay. So for like everything, we participate in the Council on Federal Financial Assistance. We're on the NOFA work group, which has 3 sub-work groups. What we've done at DHS is we are pretty diverse. We go from FEMA has fire trucks, assistance to firefighter grant program, to the nuclear research program at CWMD. So we're pretty diverse. So our office is leading it, working with our 7 grant making components. And we, like I said, all those program officers are working on. So we started immediately in May. Some of the program offices were able to do some things in fiscal year 24 because their NOFOs weren't out the door yet. But of course, the same thing, right? We're looking at plain language, streamlining the content, taking hyperlinks when we can to put them on a DHS website or a components website to reduce the number of text, the words. So we're doing all that, we're tracking it. What we've done is we've established 11 categories. We've established what we're calling the NOFO simplification template, which lists those 11 categories. So when a program office is developing their fiscal year 25 NOFO, they are going to fill that out. Again, the words, the Flesch Kincaid level, what was your previous year NOFO, what's your current year NOFO, to track all of that. It's going to be on readable form, readable Word document, so that we can create data analytics. We can use business intelligence to pull it out. So by program, we'll be able to see each of those 11 categories, what was done from fiscal year 24 over fiscal year 25. We've already begun socializing with all the program offices, and we have our NOFO kickoff meeting October 1st, but we already socialized with them the next steps in next year, because the same thing, some of these programs are huge, a couple thousand applicants. They don't talk to all their applicants who do not get the award. Some of our smaller programs, each and every applicant who gets rejected, they meet with them, they go through their application, they tell them why they did not receive the award. So what we're looking to do, probably starting in the second quarter of next year, is start to work with all the program offices on having the feedback from applicants on efforts that will basically, the second quarter will start to set up structure. But after the awards, when the time comes, that's when they'll start meeting listening sessions like NSF or what have you, talking to the applicants to see if the fiscal year 25 NOFO was better or was worse, because there's some cases where we've already been notified that there's new requirements and the language is getting more technical and needs to be added to. All right, so that's our internal process. So the goal is we're sitting here next year. We've got all this tracking on what's been done, start talking to the applicant community to see what was of value and what they suggest as we move into fiscal year 26. We are, our language is pretty standard. Our stakeholders aren't really into pictures or images, although we've offered that to the program offices. We said, if you want to put an image in your NOFO or a picture, that will help, make it easier to understand and apply. We will work with you to do such to make sure it's 508 compliant. Okay. So a lot of our program offices already have webinars. So they're going to be telling the fiscal year 25, they will be telling the community what they've done. Some of besides the general stuff, is they're looking at removing some of the sections of the NOFO that's already covered in 2 CFR. Some of our programs spell out certain rules for procurement and conflict of interest. So if it doesn't need to be in there, it's coming out. Taking one step back, I should have mentioned up front so in our office, we do the DHS standard template. And that's what we did. We always had, because it was requested by many of the program offices to spell out the application process. So we've taken that out. We referenced them to SAM.gov or grants.gov when we can to streamline some of the text. So we decreased from 26 pages in our template. Which is the guidance given to all the program officers. We went from 26 pages down to 12. We reduced the number of words on the template over fiscal year 25, 39%. And we reduced the Kincaid level to grade levels. So that's where we start at. So when it comes to, what we've done is we've submitted our NOFO simplification plan to OMB. OMB has asked multiple questions. They asked specifically for like 8 programs to focus on a few things, which we're communicating to the other program offices also to work out. So when it comes to the application process and streamlining it, one of our program offices is looking at instituting a blind review process. So what they're looking at doing is working to actually be able to redact certain things in the application so that they can't, tell who the application is coming from. So the goal there is to increase the equity. Not many of you know, I'm sure some of you know about FEMA's grant program, FEMA's new system, the FEMA grant outcomes. That implementation in itself is streamlining a lot of the burden on the applicants. Previously, the applicants would go through grants.gov to submit their application. It would then go into ND grants. Now it's just going to go into, now the applicants just go right into grant outcomes and submit their applications. Some of the functionality in grant outcomes is also like some of the forms are pre-populated, so that helps. There's some templates that the program offices are working that also is going to be able to be pre-populated by the system. So that should also help to reduce the burden. All right, what else we have? So for some of the programmatic stuff, this is where it's going to be really interesting, and our office is working with each and every program office because they just have so many unique things. Like we got from the assistance firefighters, I mentioned that earlier, they have, which actually the fire prevention and safety. So assistance to firefighter grant program has two basic programs within it. That's one that's going to get its own AL, assistance to firefighter grants, and fire prevention and safety. So fire prevention and safety has a R&D component to it. So there's an MOU that they do with the applicants. So they're looking at ways to just set up that MOU so it comes, right now it's submitted during the application process. They're looking at ways to actually just get that after the fact, all right? The fire prevention and safety program itself, they have this thing called the Comprehensive Fire and Life Safety Education Program. They're working on streamlining the requirements for that as part of the application process. All right. Some of the other things we have is a topic that just came up, question came in from OMB on Friday, was around our environmental health program, the requirements around EHP. So looking for ways to actually stream that as well, put the information, typically it's in some of the specific FEMA programs, but we're looking at putting that on FEMA's website. So it will be a link. So as you can see, there's a lot of link things going on to reduce the text. Now, for evaluation, when it comes to evaluation, so some of the programs already indicated that they were getting references in their applications to evidence-based research when people are applying. So they're looking at adding points on to applications for getting the award if you're referencing research. And then also if you can exhibit that you performed research, that the evidence that you're referencing is in fact done and will in fact help the outcome of the grant program. So those are some of the other things for evaluation. They're looking at, in general, also one of the programs told us that they're looking at the word grant. They just give a grant. They're looking to do cooperative agreement so that they're more active working with the applicant, more hands-on. So another thing is the I mentioned about the additional points for evidence-based, but also performance-based. They're looking at, if they can submit, if the applicants can show goals and performance measures that they utilize themselves, that they have successfully met, that if they put that in the application, that would also help from an evaluation standpoint. And it's also important to note, I did touch on it before, all these efforts to streamline, make them easier and better, is that, like I said, some of the programs, Coast Guard has a program, they have a new requirement that adds basically, there's a 10 checklist item where the applicant has to fill out. Statutory, it's now a 15 item checklist. So all those things will point out as well. There is I don't know if anybody knows about our Targeted Violence Terrorism Prevention Program. They're one of the ones who started in fiscal year 24 to take some efforts, but what they're doing too is they have a new criteria. It's called a privacy certificate, right? The applicant must fill out this privacy certificate when applying for the grant. That could add anywhere from 3 to 10 pages to the NOFO. So this is all to be determined. So that's a lot of stuff we're doing. Again, the goal is to capture on our end from the office I reside in is to capture all the efforts, and then next year see what they meant feeding into fiscal year 26. Any questions? Appreciate your time.
Thank you, Michael, for giving that great update. Questions will come at the end. And we are going to go ahead and go to our two federal reps from the National Aeronautics and Space Administration, NASA. We are happy and pleased to introduce Mary Sladek, who is the Senior Program Director for NASA, and her colleague, Christiane Diallo, who is a Senior Program Analyst on the Grants Policy and Compliance team. So take it away, Mary and Christiane. Thank you so much.
Thank you, Michelle. Good afternoon. As Michelle mentioned, I am Christiane Diallo. Am I coming across clear to everyone?
Yes, you are.
Okay, great. As Michelle mentioned, I'm Christiane Diallo, a Senior Program Analyst with NASA Procurement and Grants Policy Division. And today, Mary and I have a few policy updates that we'll like to go over. Listed on this slide is our contact information. So if you have any questions following this meeting, please feel free to reach out. Next slide, please. Okay, so our first update is on the BioSketch and current pending support policy, which was officially published in the Federal Register in June of this year. We want to thank everyone who submitted feedback and comments. Your feedback were reviewed and considered, and some of those comments have also been incorporated into the NASA Grant and Cooperative Agreement Manual. And for those who are not familiar with the details of this policy, a high-level summary is provided on this slide for your reference. First and foremost, all senior or key personnel who spend at least 10% of or more of their time on an award will now be required to submit a BioSketch and current pending support form with each of their application. The senior or key personnel must also certify that the information that is provided is accurate, that is current and complete, and they must also confirm that they are not a part of a malign foreign talent recruitment program. If new current pending support information is identified after submission of an application, then the entities must note this in their annual performance report. And the senior or key personnel must also submit an updated current pending support form. And in cases where a senior or key personnel fails to disclose their current pending support at either the application stage or in the annual report, the entity must notify NASA within 30 days of that discovery. And finally, the updated BioSketch and current pending support forms will soon be available on the Grants Policy and Compliance website and will also become a mandatory requirement starting on October 1. Next slide, please. All right, so our second major update is related to the revisions to the NASA grants policy documents. These changes have been done to streamline the guidance and also enhance the accessibility of our manual so that all of our external stakeholders have access. The first update is to the Grant and Cooperative Agreement Manual. We have consolidated the proposal and award guidance into one single comprehensive externally facing document. That means that the proposer's guide will be obsolete come October 1. The GCAM will now cover everything from drafting your proposal to managing your award, therefore streamlining the process and also offering our proposers and recipients clear instructions. And secondly, in our efforts to make the GCAM more relevant and accessible to our external audience, we have removed all policies and procedures that are internal to NASA personnel to also ensure that the manual is only focused on providing you all with the most important information needed. Finally, the manual has been updated to ensure NASA's compliance with the 2 CFR revisions and all of the requirements within the NSPM 33 memo. Next slide, please. All right. Another significant change to our policy document is the terms and conditions, which were previously part of the GCAM. To streamline the accessibility of users, we have extracted the terms and conditions from the GCAM to form a separate standalone document, and that will be titled the NASA Grant and Cooperative Agreement Terms and Conditions. And in alignment with the CHIPS and Science Act, we have implemented 2 new terms and conditions. The first term prohibits senior or key personnel involved with the malign foreign talent recruitment program from participating in any federally funded research and development projects. The second term is the requirement for senior or key personnel to submit a current and pending support form as part of their proposal. The general terms and conditions have also been revised to incorporate what was previously referred to as resource terms and conditions on the NFS website. You will now notice that the prior approval matrix has also been updated. We follow NSF footstep by updating prior approval matrix with just NASA specific requirements. We've also updated the national policy requirements to also reference all of the NASA specific guidelines. All the updated policy documents and the new terms and conditions are set to become effective starting October 1 and will also be accessible on the NASA Grants Policy webpage. Next slide, please. For our final update, our team will be hosting the third public-facing Ask NASA series that is scheduled in the November-December timeframe. The Ask NASA series is designed to directly engage with our stakeholders and also provide them with a platform to discuss, clarify, and address any questions that is related to all things grants process and policies. This particular session will focus on guiding our participants through the most recent changes to NASA grants policy. Now, we don't have the exact date, that is to be determined, but we do encourage everyone that is interested to stay tuned and sign up once the date is confirmed. Next slide, please. Okay, I will now turn it over to Mary for SMD updates.
Thank you, Christiane. Next chart. So I am from the Science Mission Directorate, but I am NASA's program representative. So today I'm going to be talking about matters that impact all parts of NASA, not just the Science Mission Directorate. And so I spoke about this in May. There have been some tough love given related to no cost extension requests. They continue to be denied by our NASA Shared Services Center if they are submitted after the period of performance has been ended. So please, please, please remind your PIs that they need to submit their no cost extension requests in a timely fashion so that they can be acted upon quickly. If they're submitted prior to the award's end date, but later than 10 calendar days or 45 days prior to the end date, if it's a second request, the NSSC will require that the the technical officer, the program scientist or program manager, has to approve the no cost extension before they will. So initial no cost extension requests and all subsequent must use the online form. This chart shows you that link. If you fail to submit the necessary documentation and progress report in a timely manner, that may result in non-acceptance of the request. Next chart, please. There have been some changes to the NASA Shared Services Center chart. You need to go back one. Okay, yeah, thank you. The no cost extension website is now trying to do multiple things. So this chart shows you that in addition to no cost extension requests, you can request PI changes, period of performance changes, and other administrative supplements. This is a work in progress. We recognize that, and we thank you for your understanding that this may not work exactly as you expect or as we expect. So thank you as we work to improve your options for communicating with the NASA Shared Services Center. Next chart, please. So the next item is not specifically about grants and cooperative agreements, but activities that are often done in conjunction with NASA grants and cooperative agreements. NASA does pay other agencies to work with grantees. Sometimes you propose together. Please be advised that the U.S. Treasury Department, effective October 1, is requiring that everyone use an audible system called the G invoicing, which is an information system, and the G stands for government. And this must be used as end-to-end processing for all interagency acquisitions and agreements. this type of award to another agency is not a grant. It must be negotiated regardless of what may have been submitted in your proposal. The award is not issued by the NSSC, and it will. And so the award that you get from the NASA Shared Services Center is not going to coincide with the G invoicing date. Finally, NASA funding to the Jet Propulsion Laboratory and NASA centers is not part of G invoicing, but we have been experiencing some delays getting money to the to JPL. Next slide, please. Christiane, back over to you to take us home.
Thank you, Mary. So what we have here is one of our funding opportunities from our OSTEM office. They are currently soliciting proposals from four-year minority serving institutions to address climate change. The opportunity is open until October 30th and offers up to $1.2 million in funding with a 3-year period of performance. For those interested, additional details for this funding opportunity is available on the link provided. And you can also access the NASA Inspires for additional information. Next slide, please. The final slide that we have provides you with a list of links and useful resources, which includes our YouTube playlist, where we share all of our grants-related trainings, workshops, and the NASA series that I mentioned earlier. It also includes the Grants Policy and Compliance webpage that has a copy of all of our policy documents. And that is all the updates that I have for you. So I'll stand by for questions at the end.
Thank you so much, Christiane, and thank you so much, Mary. Very nice update, very informative. So I'm going to say last, but certainly not least, the National Institutes of Health with Kasima Garst, Director of the Division of Grant Systems and Integration within the Office of Policy for Extramural Research Administration, also known as OPRA at NIH. But before Kasima gets started with her presentation, I just want to mention that we had a couple of our colleagues that had to step away and are not going to be able to provide us with their federal updates today. We appreciate their efforts and we look forward to hearing from them next time. So Kasima, without further ado.
Thank you so much, Michelle, and happy to be here with everybody today. If we can go ahead and skip ahead, we're going to get started with some policy updates. So this first slide here outlines an information that we've previously issued in a notice announcing an increase in childcare support to $3,000 for our applicable NRSA individual fellowships and institutional training awards. This was effective for fiscal year 2024 awards. The primary reason that we wanted to highlight this here for everybody in this session was to just provide a reminder that for fellows and trainees, the way that those requests will occur are the same as they have been. We just increased that threshold in accordance with NIH's continued support for our biomedical research workforce. So just wanted to provide that information. On the next slide, we are highlighting information regarding the grants policy statement. Our colleagues within the Division of Grants Policy are hard at work on the fiscal year 2025 grants policy statement that will be scheduled for release during the first quarter of fiscal year 25. However, just like some of our other colleagues, we wanted to highlight that we will be implementing the 2 CFR 200 provisions that increase the thresholds and flexibilities for recipients effective for competing and non-competing awards on or after October 1st, so for fiscal year 25. We will be issuing a guide notice in advance of the October 1st date, highlighting those changes. And then, of course, as standard, we will be issuing a guide notice that also outlines the other significant changes with the grants policy statement upon the issuance of the fiscal year 25 GPS. On the next slide, we did want to just highlight some reminders around a recent notice implementing a change in policy for domestic subawards for our SBIR and STTR programs, effective for those awards on or after September 5th. 2023, SBIR and STTR recipients are now required to seek prior approval when adding a new domestic subaward to a project post-award, where the arrangement was not originally part of the peer-reviewed and approved application. The grants policy statement for fiscal year 25 will also be updated to incorporate this new requirement. And as always, NIH continues to require prior approval when adding a foreign subaward to a project. We will also be issuing additional guidance on streamlined procedures for recipients to request these prior approval requests. In the meantime, if you have any questions, please reach out to your grants management specialist listed on your most recent notice of award. Moving on to the next update, and in line with many of the other efforts that have been discussed here this afternoon around ways to reduce burden and to streamline the application review and NOFO development processes, we did previously announce changes to NIH fellowship applications and their review process. Really, this was an opportunity for us to reorganize the 5 current scored review criteria and redefine them into 3 scored review criteria. There were also aligning updates to the PHS Fellowship Supplemental Form to align with these changes and restructured criteria. Specifically, this involved the reduction from 12 attachments to 10, so helping to streamline that top portion of the Fellowship Supplemental Form. And I'll go over that a little bit more in our systems process update section. These changes will be effective for application submission due dates on or after January 25th of 2025, and the applicable activity codes are referenced below. On this upcoming Thursday, I believe, there will be a presentation around some of the changes that are coming with some of those updates, and then there will also be another fellowship webinar in early calendar year 2025 as well, regarding any folks that are new to applying for fellowship awards at the NIH. Transitioning to another effort having to do with review framework, we previously announced that NIH has also simplified the review framework as it relates to some of our research project grants. This again was an opportunity to see where we could streamline and clarify the review process to simplify the current 5 regulatory criteria into 3 factors and better focus peer reviewers on the key questions that are needed to assess the scientific and technical merit of the proposed research points. So these will also be in effect for application due dates on or after January 25th, 2025. This does apply to most of the research project or RPG activity codes, with the exception of codes like for the small business programs and things of that nature. But those are all outlined within the applicable guide notices. And lastly, another update having to do with the recent efforts that NIH has been involved in regarding our data management and sharing policy. We did previously announce that we will be requiring progress reports, or the RPPRs, to address those NIH data management and sharing activities from the approved data management and sharing plan. This will also involve updates to the RPPR form, as well as the instructions effective for those RPPRs submitted on or after October 1st of 2024 for applications that were subject to the new data management and sharing policy. Those changes are still on target for October 1, and the RPPR instruction guide will also be updated to in accordance with these changes. So stay tuned for more information coming on that. For time, I'm going to go ahead and shift over to the system process updates. So the first one, again, related to that SRF effort. One of the things that we wanted to highlight here for you is that for any applicants that are applying to NOFOs subject to those activity codes under SRF, you'll start to see a lot of NOFOs being reissued, or maybe even some that were initially published earlier this year without an application forms package. This is because the Forms I application forms are not yet currently available within production. I'll talk about that a little bit more on the next slide. However, the main thing we wanted to highlight was that because, especially for SRF, the forms themselves are not undergoing a change in terms of the content as part of the application assembly, you can go ahead and begin to prepare your applications on your current forms. And then the submission systems have convenient copy features in order to transfer to the Forms I application forms packages. But don't be alarmed if you do see those NOFOs without those application forms packages, if they are subject to these SRF efforts. We will begin posting those very soon, and they will, of course, be on those NOFOs well before the application submission due date. So transitioning to the next slide to talk a little bit more about Forms I. As we mentioned, this is effective for all applications submitted on or after January 25th of 2025. We previously issued a guide notice that outlined the different efforts that are part of this initiative, as well as sort of a summary of things to come for January 25th and beyond. And the key thing that we wanted to alert the community to for this presentation was that the Forms I application guide and associated form packages will be available starting in late October of this year. So the application guide is anticipated to be published by October 25th. And then we will also begin posting those Forms I application forms packages to all active NOFOs and ones that are newly being published. So expect another guide notice around that time, but just know that that process is getting started. And for those who are actively looking for those training data tables and things, we will be posting previews of that information within the next couple of weeks, and then also the full production level versions of those editable tables shortly thereafter. So stay tuned, but those are coming. Just really quickly, what I wanted to highlight on the next two slides were just the mock-ups of those forms that are going into production, particularly here on the fellowship supplemental form, where we just highlight the top portion of the supplemental form that is being updated. And as you can see, we've streamlined this form to be a little bit more clear, differentiating not only between the fact that the candidate versus the applicant organization. So you can see that second section label being updated to the candidate section, while also streamlining some of the forms so that we reduce not only the number of attachments, but some of the pages that are required for those fellowship applications. And then the next slide outlines a change that is occurring on the research training program plan form, where we have taken the recruitment plan to enhance diversity and pulled that out into a new attachment field, attachment number 3. This was previously provided as specified in a NOFO within the program plan. Not only will this provide greater transparency when this attachment is required for reviewers, but it also frees up a few pages of the program plan for other required details for you to talk about your program plan narrative. Transitioning now to a topic that I know everybody is very interested in, the common forms for the biographical sketch and current and pending other support. As we've previously mentioned, this is going to be effective for all applications and RPPRs submitted on or after May 25th, 2025. We will be adopting the common forms for both the biographical sketch and current and pending other support without change. However, we will also be collecting a separate supplement form to collect the 3 required agency-specific data elements, namely the personal statement, the contributions to science and honors, and in order to adhere to our peer review regulations within 42 CFR Part 52. One of the other key areas around the requirements for this adoption is that applicants and recipients will be required to use Signed CV for the completion and certification of these forms. And Signed CV will generate that digitally certified PDF for use during application submission. The key thing that we wanted to highlight around our choosing the May 25th effective date was that we are working very closely with Signed CV to develop data entry tools for our applicants to be able to complete those forms and upload the data, particularly for the current and pending other support, to help reduce that burden for our applicants as part of our transition. One of the other requirements will be the use or the requirement to enter the ORCID ID into signed CV in the persistent identifier section of the common forms, as well as requiring that those senior key personnel link their ORCID ID to their ERA Commons personal profile. The main thing that we want to highlight is that you're able to go ahead and do that right now. That functionality is already available within the ERA Commons to link your ORCID ID. So we highly encourage you to do that as part of your preparations for May of 2025. And we've had a lot of great success rate there, and ERA has some fantastic help tools if you need any help in that regard. And lastly, regarding the common forms, as a reminder, until we fully adopt those forms in May of 2025, NIH does still require applicants and recipients to use the current NIH BioSketch and other support formats, and that electronic signatures and the required supporting documentation must still be provided. Failure to follow these appropriate formats may cause NIH to withdraw applications from or delay consideration for funding. Next slide, please. So this next systems process update is just a heads up to everybody that effective October 1st, NIH will be retiring the automated just-in-time notification that is sent from ERA systems. The real reason around this was based off of user feedback around the notification and the confusion around whether or not this was associated with an official request for submission of just-in-time materials. The official email request will be sent directly by NIH staff at the awarding institute or center, as always. And those are the ones who will not only send the requests via email, but they'll also specify all of the just-in-time that is required by the applicant. Even though we are retiring the notification, the just-in-time link within ERA Commons in order to submit those materials when requested will still be available in ERA Commons until the application is awarded. The functionality around when that link becomes available and when it is closed is unchanged. So either the PI or the SO can still upload that and save that information. However, again, as a reminder, only the signing official is able to submit it. So the functionality remains unchanged. You'll just no longer receive that email notification generated from the systems and instead continue to receive the email with the official request for just-in-time submission from the awarding institute or center. My last systems process update slide is one that I know we have been working on as a whole within OER. We are announcing a redesigned NIH grants and funding website. This will officially launch on September 24th. This was designed based on analytics and user feedback, and with a real emphasis and increased focus on new users, new to NIH or new to the NIH grants process. And we've also really emphasized an improved opportunity search functionality for our NIH guides to grants and contracts. One thing I am going to put very quickly into the comments for everybody, since this was just published, is a guide notice that announced this update coming on September 24th. And it also has a link to a video walkthrough or video tour, excuse me, of the new site. So we're very excited about this redesign. It is going to also help us as part of our ongoing efforts towards the simplification of NOFOs and simpler grants efforts, particularly around those enhancements to the guide search, being able to better display information for our applicants as they look for NOFOs and how to apply for NIH programs. The key thing we also wanted to highlight for everybody is that there are a lot of changes to the URLs for these pages. So please make sure to update your bookmarks and websites and other resources at your institutions very soon. However, we will have redirects in place for at least a year as this transition takes place, but we did want to at least give you a heads up on that. And lastly, I'm going to transition to some compliance updates. This one update that we have in particular is around the continued extension of certain flexibilities for our BESH, basic experimental studies with human participants, or BESH. So the extensions are that were previously issued for results and registration reporting requirements through September 24th of 2023 have now been extended, and BESH studies responsive to designated BESH NOFOs with application due dates on or after September 25th will be expected to register in clinicaltrials.gov and report summary results information to either clinicaltrials.gov or regulations.gov in accordance with the NIH policy on the dissemination of NIH-funded clinical trial information. That being said, NIH continues to expect registration and results reporting, but with that additional flexibility through September 24th, 2025. We are also developing an alternative approach expected in 2026 for awarded BESH responsive to a designated BESH NOFO that will allow the posting of summary results information in a designated docket in regulations.gov. So that approach will require linking to clinicaltrials.gov study records and to corresponding results information posted on regulations.gov. There is more to come on this change, and we will provide resources to support registration and submission of summary results information when available. And lastly, we have a couple of slides outlining some resources, particularly NIH listservs. One thing I did want to highlight was especially encouraging folks to sign up for the NIH Virtual Grants Conference and Events listserv, particularly as we've had a lot of really wonderful webinars related to the many changes to our applications, preparation and submission for January 25th and beyond. So that you'll be able to find upcoming webinars there, as well as video recordings of the prior sessions, including one, if you can go to the next slide, that is already posted on our OER Virtual Webinars webpage, where myself and Alan Watley, our amazing leader of the Opera FFR Center, will be giving an overview of the NIH grants closeout process. So feel free to register for that, which is taking place tomorrow, or catch the recording of that when it is available. And lastly, I'll turn it back over to Michelle for any further questions.
So thank you, Kasima, and thank you to all of our federal panelists. It's really great for us to hear what everyone is doing, also to share with our FDP institutions. And I just want to thank each and every one of you guys. I'm going to turn the reading of the questions over to Maria, and Maria will go through those and will help get those answered for you. Thank you so much again.
Thanks so much, Michelle, and thank you to all of our presenters. First question from Joan Cyril. Is it possible for each operating division to use a common NOFO similar to the common form? And that sounds like that would be a question for HHS.
So I do believe that Dale Bell has left our panel. But I will say that for the simpler NOFOs, the goal will be that each required section, honestly, will be applied to all of the OpDivs. But of course, the text, the program goals, the mission is going to dictate what kind of information that's placed in those required sections. And so I don't know that we can have a common NOFO with all of the same text, but we will have a common, I guess what you would call a template. So happy to take that back to Dale just to make sure that I've adequately represented what the goal and the vision is. But certainly OMB has always had that common template that we all use. The challenge is what we put in the information because it is a program specific goal and an agency specific mission. Jean, would you like to jump in as well?
Yeah, and actually, as part of the exercise we're all going through with OMB, we are putting forward pilot programs for NSF. We have something called PIMS. So all of our templates have the same, much of the same content. But the bottom line is OMB is going to be looking at that to see what you're doing to ensure that your content at least includes the content that Michelle just talked about, to ensure that we do start to look more consistent across the agencies. Now, given that there are various types from construction to research, et cetera, they won't ever be exactly the same, but the content and format is something, the format is something we're very much looking to try to achieve.
Thank you, Jean.
Thank you, Jean. The next one I think is meant for Dale and probably Jennifer. And I think the way I'm interpreting this question is that it's more of some feedback regarding, I think they mentioned that in some of the places in the NOFO, they were including links. And so the concern here, again, I'm interpreting this, is that the reviewers and may not look at the content of the links. So replacing text with links might end up resulting in more links. So I think that's again, that seems like it's more of a comment for Dale and for Jennifer.
Well, we actually mentioned that we're doing that same kind of approach. And I will say that in our case, every single one of those links in almost all cases is to the PAP guide. And I can assure you the PAP guide goes through an unbelievably rigorous, much bigger review process. So it's not like we're just going to throw you to something that hasn't ever been reviewed and no one's taken a look at it. And I know Jennifer wants to add something to that as well.
No, that's exactly right. That's the vision for it. Correct. Cleaning up the one document.
Exactly.
Somewhere else in some instance. Yeah.
Exactly.
Great, thank you. Thank you for that clarification. I think that was really, really very helpful. Next question from an anonymous attendee. When will final 425 reports be available in the payment management system, PMS?
So I'm not quite sure I understand that question.
We don't have additional information. If the person who submitted that question could provide a little bit detail, perhaps we can answer that question later. We'll move on to the next question. Okay, thank you, Michelle. All right, regarding the threshold increase, does this mean that the new thresholds can be implemented mid-competitive cycle? And I think is that an NIH?
It is an NIH question, but Kasima, do you want to take that one or would you like for me to take it? Happy to turn it over to you.
If you'd like to start off, Michelle, that would be great.
Okay. So I think in the actual guide notice, it says that the changes will be effective with FY 2024 awards, and that some of these will be automatically or revised retroactively to increase the support for all eligible slots for training and fellows. So that would indicate then that it would be mid-competitive segment.
Yes, and I'll just add on top of that as well. So what we also emphasized within the guide notice was that there was not going to be a need for recipients to request an increase for that cost. Those were, as Michelle indicated, automatically adjusted by the awarding institute or center. but it was from the fiscal year 24 award moving forward.
Thank you for that response. The next question is for NASA. When will the next SF425 semi-annual reports be available in PMS for completion for a period ending 9/30/24? Will those be posted later this month or in early October? Thank you.
Unfortunately, I was hoping to get that answer from our finance group, and they didn't get back to me in time, so I can definitely follow up with them.
All right, thank you. Next question, again, anonymous attendee. Can you speak to the rollout of an interface to upload current and pending support information into Science CV?
That's definitely an NIH question, Kasima.
Yes. So regarding that upload, so we are working very closely with Science CV in finalizing what exactly that will look like, whether it is an API or another form of sort of a data upload functionality. We will announce those specifics as soon as we get those finalized, well in advance of the May 25th deadline. But ultimately, it is going to allow applicants and recipients to upload that information in more of a bulk format. I think this also aligns with one of the other questions about integration with institutional tracking systems. So whether it is an integration like system to system option versus an upload, I'm not sure. But the intent was to take into account the fact that we knew our applicants and recipients had these systems in a way to sort of get that data rather than having to manually do it on an individual basis. So the details of the technical piece of that are forthcoming, but we will be communicating that as soon as it's available.
Great, thank you. The next question is about the slides for this session. So we will be posting the slides on our website, and that probably should be in the next few days. We have a question from Robert Wood. Will the new NIH form supplementing the BioSketch current pending data also be built/certified on Science CV?
Yes, it will.
All right, thank you. Okay, here's another question from Allison. On Science CV, is there a way to import data from an internal institutional OS management tracking system? The OS pages are, as we all know, are administratively burdensome, and I'm wondering if we can still be able to use our homegrown system and export required data into Science CV. Thank you.
Yes, Allison. So just reiterating what I mentioned on the last question. So that is what our intent is, to allow our applicants and recipients to be able to utilize that functionality. Again, the technical specifics of that are still being finalized.
And that is something that we have been asked for at NSF since we started using Science CV. So it's absolutely a big ticket item for the community. We know that. But the policy side, we're on board. It's the technical details that have to be worked out.
Thank you, Jean. Thank you, Kasima. This is a question for NIH, perennial question. Is NIH evaluating raising the modular cap?
NIH has had a lot of internal discussions, and this seems to be a question that we get quite often in every venue. So we have talked about that. We've talked about how dated the cap is. And we've talked about, the fact that we probably need to rethink it. But we also kind of talked about whether or not it would be still under a modular concept. So there have been lots of discussions. No decisions have been made, and we will absolutely keep the community abreast of any changes that come your way as it relates to modular grants.
Thank you, Michelle. All right, next question from Susan Anderson. For 2 CFR 200 updates related to increased thresholds for equipment purchases and subaward funds subject to prime recipient F&A recovery. Reminder that each institution's federally negotiated F&A rate agreement may prevent application of those increased thresholds until they are renegotiated accordingly. So it's just, it's not a question, just.
It's really important though, because they're not going back. At the last NICA conference last
That's
week,
right.
it was made very clear that they are not going and opening up rate agreements and modifying them. So you're going to have to wait for your next one. So that's something, a very good comment.
A very good comment, and it's come up a couple of times. Yeah.
Great. Thank you, Michelle and Jean, for that response. Very helpful. All right, the next question is from Krissa. And I think, Jean, you had actually answered this question in a previous question. So in the answer tab, I think there was a comment about the prior approval matrix. So let me read this question. Is the FDP planning to issue a prior approval matrix similar to the one just issued for NSF? The comprehensive, and I'm not going to read all the agencies, is dated November 2020. And then they share the link for that. And I think, Jean, you had responded to a prior approval matrix question.
Right. It's all tied to the research terms and conditions.
Mm-hmm.
So there, as part of research terms, there's a prior approval matrix, a national policy matrix, and a subaward matrix. And because we're not doing the research terms, it doesn't mean not forever, but right now, those documents were only updated for each individual agency. I think NASA mentioned they updated theirs as well. However, I think it's a wonderful suggestion. And I think this is a service that we could work to just consolidate all the agencies into one. And I think that's very viable and a great suggestion. But I leave it to my colleague, Michelle, because she's our great leader. So I think it's a great idea myself.
I agree with you on the great leader, but I also agree with you on the great idea as well. Just kidding. No, I think we should talk about it.
Yeah, we should
have a discussion at our next FDP.
Yeah, we've got one coming up, so that's a great agenda.
Very good one. So we'll jot that one down. Thank you.
Thank you, Jean. Thank you, Michelle. So the next one is for NIH. First, thanks to Kasima for the update. Could you please clarify NIH's single audit requirement for foreign recipients? What is the correct threshold for this? According to a recent NIH policy notice, July 17, 2024, the threshold for foreign entities is $750,000 in federal awards effective October 1st, 2024, but the updated 2 CFR 200 subpart F states it will be 1 million in federal awards for everybody, also effective October 1st. So they're asking for clarification on that one.
So I'm going to take this one, Kasima. So for our foreign awards, agency, NIH has decided and determined that we would like to lower that threshold to 750,000 and not use the 1 million. And we do have the authority to do so. We have put that out in our guide notice, and the modification in addition will be added to the grants policy statement as well as our significant change matrix. We really want to make sure that we are able to stand the test of an audit. And at times we recognize that the recipient, the auditors, NIH leadership, and our recipient community might not always be on the same page with these things, but we really do believe that that 750,000 is a reasonable amount for the foreign entities. And so that's what we have put in place effective October 1, 2024. So thank you.
All right, great. I'm going to scroll down a little bit further because
Can I ask a point of clarification? Somebody followed up and said that was a NASA question. So did I miss that? Does that mean other agencies are doing the same thing as NASA, requiring a lower threshold for foreign organizations as well?
So I do know that CDC is 750,000, and that's
Yeah.
within the HHS umbrella, but I can't speak for other agencies. We
Okay.
aligned ourselves with our sister agency under HHS.
All right, I'm going to scroll down a little bit further. For the, again, anonymous, for the increased threshold for fixed assets from 5K to 10K and subcontracts, MTDC increasing from 25K to 50K, I'm assuming all proposals being submitted should include these new amounts.
Well, remember what we said there, to be careful if it is something in your rate agreement. You may have to wait till the next rate agreement is negotiated. You would check with your COG agency on that.
Seems like it might be, taking that under advisement for your competitive awards, but non-competing, we wouldn't change it.
Yep.
All right, thank you, Jean. Thank you, Michelle. Next question from Maggie Ewell. Would NASA consider using Science CV for current and pending and biosketch submission?
Hi, I'm going to take that because this actually links back to the G-invoicing chart I presented. So to participate in Science CV, the agencies NASA has to pay to participate, and that is through the G-invoicing process, which at this point takes about 6 months to set up. On top of that, NASA's funding organizations, not everybody is interested in participating in Science CV. The Science Mission Directorate is, the Space Technology Mission Directorate, but there are other big funders of grants who are not necessarily particularly interested in participating. So we are discussing, grants policy has been convening us, but we haven't made a decision yet. Finally, we do have a problem with things that are generated in Science CV getting uploaded to NSpires. I spoke about this a year ago in May. The files become editable when they get uploaded to the NASA solicitation and proposal review system, NSpires. So at this time, we do not participate in Science CV. Some of us are very enthusiastic about it, but we have to all get on the same page. I'm not there yet. Thank you.
Thank you, Mary. We have another one. Well, the next one is a comment for NASA. The SF425s via PMS are a heavy lift on a short time for NASA heavy institutions. We have been unable to bulk upload reports. So that was just some feedback for NASA.
We will take it back. Christiane has to drop off for another meeting.
Okay, thank you, Mary. All right, next question. If we are in a non-competing year and capital equipment is purchased in December 2024, that is 8K, does the new threshold apply? Or since it's not a quote, not a new award, does the old threshold apply? This is difficult to implement for institutions.
I think Jean and I've answered that one in a couple of different ways. I'm not sure how else to answer, and we understand and agree that it is probably difficult, but it's also something that we felt important to implement, especially for the increases in the threshold flexibilities. So we understand that. Jean, I don't know if you had anything else to add.
Okay, I'm not hearing anything from Jean, so if I could go to the next question. I don't know if we answered this one. Will NIH consider raising the 500K cap for most proposals, including R01s?
NIH has not had a discussion about raising the cap.
Okay.
And I think it's the consideration. There has not been any discussion. And so I can take that back and share with leadership, but not certain that we would be thinking about doing that at this time.
All right, thank you for that, Michelle. Here's another one about rate agreements from an anonymous attendee. It was indicated that the cognizant indirect agencies won't be opening up existing rate agreements for the increased EC thresholds. Will they permit rate proposal packages submitted but not yet negotiated to be adjusted?
I think that's something you need to speak about with the rate, with your COG agency. That's not something we should be answering here, or can't really.
Mm-hmm. All right, that makes sense. Thank you, Jean. Okay, this is another one related to indirect cost rates. Given that it will take the cognizant agency literally years to work through all NICRAs to update MTDC, which will cause administrative burden and confusion, is there a chance that OMB will issue a technical correction to stay with 5K equipment and 25K subawards?
I don't think we could speak for what OMB may.
OMB will do. Yeah, no,
Yep.
I don't think so.
Yep,
either.
agree. All right.
I think last time FDP, they kind of talked about it when they gave their update, but I don't know if anything has changed since then.
Yeah, they kept going back and forth, and then they finally said, we'll just have to take it back. But the reality is a rate agreement's a rate agreement, so.
Okay, we have another Science CV question. Orchid had, and this is from Elizabeth Adams. Orchid already has technology available to integrate with universities' enterprise systems. Is there separate consideration to have Science CV also integrate with our systems?
I can take that question back as part of
Okay.
our ongoing discussions with them for the technical implementation. So we'll take that back.
Yeah, it's the same with us as well.
Okay, thank you.
There's great opportunities to do a lot more with Orchid than we currently do. That's for sure. And so we'll see what we can do there.
Great, thank you. And the last question that I have open is directed to NASA. Are applicants supposed to use electronic signature like DocuSign as an example for biosketches and current and pending? Will that be required effective 10/1?
So we are not specifying how to sign your forms. We will be putting up more information on 10/1 related to what NASA expects in terms of the certification. Christiane answered a similar question in the chat. I'm trying to find it, where she explains that the institutions have to keep the signed documents. They'll be the official record holders. As I mentioned, there was also some chat about folks wanting to use those forms. The forms, if you digitally sign something right now and submit it to the NASA electronic submission system, the signature breaks. It's still so there will be some steps explained to how to prepare the form to submit to us, but you will be responsible for signing and keeping the signed copy. How you choose to sign it, Penny, DocuSign, that's going to be up to the submitter. Hopefully that makes sense.
All right. And I just wanted to thank our federal partners. They've answered, I see several questions were answered directly in the chat, and I think you've had some follow-up. And also there was a comment, thank you, Jean, you never disappoint. And I think that's true, you know, very much so. And I want to thank all of our federal partners for presenting and for answering all these questions. And I'd like to thank Michelle Bowles for doing all that she does as our federal lead. to the FDP. I know she's been working closely with the federal agencies. She has a meeting planned in October, and I know that you know, this has been a really informative session, and we really appreciate it. I'm going to turn it over back to Michelle if she has, and ask if she has any parting words.
No, I just want to just thank everybody again. And I actually, while, you know, the title is federal lead, I really consider myself a partner with my colleagues because none of us can do it solo. I am so grateful to be able to partner with them in this capacity. And I'm looking forward with, you know, to our next meeting. Jean, I think we have a really good agenda item for one of them. And I just encourage everyone to participate, because I think the more that we participate together, the better we can come up with this and really massage this administrative streamlining burden effort. And we really get at the heart of what FDP is about. So thank you guys so much for having me.
Thank you. Thanks to everyone. We actually are making it with a 1 minute to spare, so it's a miracle. Thank you.
Thank you.
Bye, everybody.
Bye-bye. Thank you again.
Thank you.
Bye.